Good morning, Facebook. I'm not set up yet, but I have faith that I'll get there. How about that? Let's see. Let's see what I need to do. I'm late. I'm late for a very important date. That'll work. Something like that. Maybe I'll just hold you for today. That'll keep me short for a change, because you know how I always get excited about doing my Facebook Lives. And hi, Laura. But I'm excited most of the time. That's just the way I don't know. I guess that's the way I do life. So today we're going to talk about breastfeeding, about boobies and babies and the good and the bad. And you know, it's not always as easy as we'd like to think it's going to be. So yes, breastfeeding is natural. Yes, we're made to do it, just like we believe that about birth. But sometimes it's not a cakewalk. And sometimes moms feel really discouraged and frustrated by certain things that happen or by that first couple of weeks. So we're going to take it back. Let's take it back a little bit. Let's take it to pregnancy. Let's take it before pregnancy. Let's take it to like puberty. How about that first? So let's do puberty. When we develop breasts, depending on our genetics, and sometimes depending on if we, and maybe PCOS is part of our genetics, but PCOS can cause some breast problems as well. But sometimes our breasts are not well formed for intuitive and easily breastfeeding. Let's say it that way. So babies need, I always say they need about 2 knuckles worth of nipple in their mouth up on their palate to trigger the suck reflex. So we need to get a lot of boob in a baby's mouth before a baby wants to suck that, right? And some babies come out, they're really sucky. I call them my little sucky babies, right? So they come out, they are on it. They come out smacking their lips and rooting their noses and looking for a nipple. And those babies are a dream. We're going to talk about that though, because sometimes they can become trouble too. But then there's other babies who just really need that suck reflex stimulated in order to create that desire to nurse. So here's the thing. Some women in their genetics or in, like I said, in puberty, their breast tissue develops with either flat nipples or inverted nipples, which is something I worked on here recently. Flat nipples just mean that they don't stick out. So they're not the traditional nipple that sticks out past the colored areola. And the areola is the pink circle around your actual nipple. So the areola is the circle tissue that's a little darker than your regular skin, and the nipple is actually the piece that protrudes. So some women have nipples that don't protrude. And if they don't protrude, again, thinking how much we need in that baby's mouth, it's sometimes hard to get that suck reflex stimulated. But other women actually have inverted nipples, and those nipples actually get trapped in a skin tissue, and they actually stay inside all the time. They don't ever become erect. They're actually divoted into the skin. So you can imagine if a baby needs that much to suck on, sometimes it's hard to draw those nipples out. So we have those different kinds of nipples, different kind of breast tissues. Some are very dense, some are very small. Some women who are very large and have heavy breasts sometimes feel like there's too much breast for breastfeeding. So one of the things that we need to do is to think about what those breasts are like before we have a baby. And I actually found this week, you know, we keep learning, and so I'm going to have a confession here. I tend to ask women, because I'm really pro-woman, pro-body knowledge. You know, how do your nipples look? Do they stick out when you become cold or aroused? And if they say, they're kind of flat, or I don't think too much about it. But the other day I had a mom who had told me that, and then when we actually tried to get a baby on, her nipples were really badly inverted. So I actually am going to plan, you know, we live and learn. I'm going to plan to be a little more assertive about really quizzing moms on those nipples. So if you haven't had me do that yet, be prepared for our next appointment. That we're going to talk about what do they look like, because we can start working with inverted or flat nipples in pregnancy, and we can help to get them more erect and to be able to make them more extroverted. If we're introverted, we have to be extroverted, right? So we're going to get extroverted nipples. Those are the friendly ones that kind of come out and say, hey, I think I may have coined a term, a boobie term. So now we have a baby, and we try to get that baby on the breast, and the golden hour, all of us hear a lot about, like, we should get a baby to the boob within 30 minutes or within, at 60 minutes. They want they want that breast. So babies, when they come out, they're at their peak desire to nurse. After they nurse and they are alert for an hour to 2 hours, they usually take a really good long nap. And there's a reason for that, right? That good long nap also lets mamas take a good long nap, and they're both able to wake up and start the day fresh, so to speak. Here's the problem. So we talk about that, we talk about it, we read about it, we're going to get that baby right on the skin, we're going to get that baby right to nursing. And then what happens when our babies don't really want to nurse right after birth, right? Some of those babies, they don't have a strong suck reflex. They don't really have much interest in nursing. They just are born, and they're happy and they're alert and they're well transitioned, but they just are not looking for a nipple just yet. So I tend to try to be very laid back about that, and there's a reason for that. Certainly we put baby next to the nipple. Certainly we have baby root and lick and suck and smell and look for that nipple. But I also feel like that's the wrong time to create a load of anxiety in a new mom about latching a baby, right? So I feel like if we force the issue too much, it just creates this really kind of cruddy golden hour. So what's worse than a baby not nursing during golden hour? Stressing a mom out about a baby not nursing during the golden hour. So I feel like the lesser of two evils is to let everybody have a break and recover from birth, recover from that big emotional roller coaster that you just came off of, and know that we need to get a baby latched on before we send a mom home. And we always do that here. We don't send you home until we have a baby on the boob. But now let's talk a little bit about those different kinds of nipples that we were talking about earlier. If we have, so there's two kinds of babies in my opinion. There's sucky babies that could draw a nipple out of an inverted nipple, out of, like, they could just suck. They suck on their fists, they suck on their fingers, they suck on your neck, they suck on your arm. These are the babies that moms often say, like, she'll never get off of the breast. Like, I nurse for an hour and a half and 2 hours at a time, and when I lay her down, she's still sucking. God bless them. Those babies are amazing. They're wonderful. But you know what? I have moms complain, and rightfully so, that, like, this baby just won't be happy without me. So that's one kind of problem we have to solve sometimes postpartum. The other part of the problem is a baby who doesn't really want to suck. And if that baby is combined with inverted nipples, holy moly, we've got work to do. We got work to do. I always say my commitment to breastfeeding is equal to my mama's commitment to breastfeeding. I don't have to get up at 2 a.m. and try to latch a baby who's not easily latched. So although I love breastfeeding, although I want you to breastfeed if that's your desire, I often say my job's not done till I have a babe on a boob. I also want to honor moms who make different decisions or need different solutions for whatever reason. So let's say that first. Like, we're talking today about breastfeeding. We need to have as much grace for moms who choose not to breastfeed as we do for moms who choose to breastfeed, especially those moms that need extra TLC to get the rhythm established. So the first 2 weeks here at Embrace, we tell you the first week, I want you in bed, skin to skin with your baby, done. I don't want you to get up for more than a shower, go to the toilet, get back in bed. People feed you, people take care of you, people let you sleep when your baby sleeps, and I want you to just bond with that baby. That baby moon is important. The second week, you can go to the couch. But I still want you to just be focused on baby care, on nursing on demand, on skin-to-skin time with your baby. The interesting thing is, generally, if we do that for 2 weeks, babies find the nipple, moms find the rhythm, breastfeeding is off to a good start, and we're done. We're done. Babies are gaining weight well. We're making progress. However, sometimes that's not enough. Sometimes moms need more help. So today, and like I said, I dealt with this week, and it Doesn't happen very often here that I need to call in an IBCLC or that I need to call in extra help, but we are sure glad we have them when we need them. So I do breastfeeding a lot, but I don't do it for a living. And sometimes getting a professional breastfeeding advocate and educator on board is exactly the right answer. So we called in at IBCLC for a baby who had had a tongue tie and then needed additional help retraining how to actually latch properly. The tongue tie revision and the lip revision didn't do all the work, so we brought in an IBCLC who really made a difference. Excuse me, allergies are bad this morning. So what do we do with those moms who are struggling with either a baby who is not sucking, not a strong suck reflex, or a baby who can't get a good latch on a nipple? There's lots of tools we can use besides a IBCLC, which is absolutely a good tool. During pregnancy, we've had good luck if we get the information in time about inverted nipples using breast shields to help bring those nipples out. And they're worn throughout pregnancy. Talk to your provider about how to do that, but they are a good tool for helping those nipples start to protrude a little bit more. And then after the baby's born, now everybody start throwing darts at me and we'll try to duck. There's a thing called a nipple shield. Now, people either love or hate a nipple shield. I'm not even going to lie. They're going to love or hate it. So there was a big discussion this week about nipple shields and how those might help and how those might hurt. There are some studies that say if you are on a nipple shield long term, that you might have a reduction in milk production because the breast is often not emptied well. And also mastitis, again, because the breast is not emptied well. Now, we could certainly remedy that by pumping off what's left behind after a nursing. Again, I wouldn't do that for the first 2 weeks, but you could solve that problem by doing that. That also help keep your milk production up. Okay, nobody throw anything at me. I actually think a nipple shield is good care once in a while. So here's the thing. If I have to send a mom home to try to establish a breastfeeding relationship and the latch is terrible, not because we haven't worked with it, but because either of inverted nipples, which is the number one reason I think, I think that giving that baby, now, so I guess I should say what a shield is. A shield is a very, very thin silicone piece that you put over your nipple, and it's kind of like a bottle nipple. It sets over your nipple, and when the baby begins, so it's hard enough that the baby can be triggered on the roof of their mouth for that suck reflex because it's out. Now, when the baby starts to suck, it pulls your nipple into the plastic, into the silicone. And so then it allows your nipple to be pulled out and the milk to flow. Now, again, the problems are there's some studies that say that long term it's going to reduce milk production. It's going to cause an increased risk of mastitis. However, I think that sometimes it's good care. It gives mom the tool to get over that critical first couple of weeks. So we always recommend a shield is used temporarily, that you offer the baby the breast every feeding without the shield. So we try to latch the baby without the shield, and then if we need it, we use it, we finish that feeding, and we try again the next time. We continue to try to get that baby back to the nipple alone, but we have to be conscious of the fact, especially as providers and certainly on Facebook support groups, right? That I'm not the one feeding that baby at 2 a.m. I'm not the one who's exhausted and sore and leaky and trying to get a baby to latch on a flat or an inverted nipple. If the baby's not a good sucker, trying to get that trigger reflex, that suck reflex triggered. So again, as providers, somebody said to me this week that I thought was, I try not to let the perfect get in the way of the good. And I thought that was such a great way to describe nipple shields. Yes, we want moms and babies off nipple shields after a short period of time. Yes, ideally, once that baby really gets the idea that mama smells like milk, we can continue to work with that. But I want us to rethink what we're setting our moms up for in that first 2 weeks. And what I want to set my mom up for is success and confidence and rest and support. And breastfeeding is a big piece of that. It's a big piece of that. And moms who have struggling nursers and moms who have inverted nipples often feel very broken and very rejected and very emotionally exhausted. And I feel like nipple shields can sometimes get them over that hump, get them feeling more like themselves, give them the opportunity to start gaining confidence, and then we can continue to help them wean back off of that nipple shield and onto just nipple. So I guess that was on my heart this week. It was just something that was really a struggle for us and certainly caused a lot of anxiety as we tried to consider what was the best choice for moms and babies. Breastfeeding for moms who choose to do it is critical to their birth story, to their parenting. And certainly I am a huge breastfeeding advocate. I think we run probably close to 99% around here. Sometimes due to breast tissue, sometimes due to anxiety, sometimes due to some women who have sexual trauma in their past. They just don't want to nurse or they can't nurse, and we respect that as well. But again, our commitment to breastfeeding is equal to our mom's commitment to breastfeeding. We certainly want to give you every tool possible for success. Ultimately, we know that breastfed babies are healthier, that they have less risks of obesity and some diseases later in life. But I also don't think, I like the saying that fed is best, and that is absolutely true. Sometimes we find alternatives as well. So for everybody out there struggling with breastfeeding, know that you're not alone. Know that you need to let your baby run the show for a couple of weeks. For 2 weeks, I just want you to nurse that baby every time that baby even looks hungry. It's never the wrong answer to put a boob in his mouth. Like, that's always an option, right? Just put a boob in his mouth. If he doesn't want it, he'll tell you. And in 2 weeks, if baby's gaining well and everything is adjusting, we can re-look at that every minute of the day baby on the boob if that's your problem, because that's the one thing, right? The one side of it is my baby won't stop nursing, and the other side is my baby never nurses. And one side I hear, I have so much milk it's running down my leg, and on the other side I have no milk, I'm sure my baby doesn't get enough. And breastfeeding is our connection to the baby after pregnancy. And believe me, you are growing a baby for at least another 6 months. Breastfeeding is just as important for your care and nourishment. You're providing that for your baby, so make sure you're taking care of yourself too. And after 2 weeks, talk to your provider. If it's not smooth by that time, we certainly want to be back in there in the trenches with you, giving you more help. Here at Embrace, we see you at a 24 to 36 hour home visit. We follow up midweek if we need to. We see you at 1 week and 2 weeks and 4 weeks and 6 weeks, because we want to make sure that you're thriving and so is your baby. I hope you all have a good day. I hope that if you are not having an easy breastfeeding relationship, that you'll reach out to one of the support groups, reach out to your provider, reach out to us, and we'll help connect you with someone who can help you get through it. Breastfeeding is natural, but that doesn't mean it's easy. And for some moms, it takes a lot of willpower to get through. And that doesn't even start to touch on things like sore nipples and other issues, which we can talk about, things to do to help alleviate that on another Facebook. Send me in your questions, but next week I have a treat for you. We're not going to talk about babies. We're going to talk about a life philosophy that I'd like to share with you, something that I think will help you through your pregnancy and also through your parenting years. Here at Embrace, we have a tour today at 1 o'clock. We always do tours Tuesdays at 1 and Saturdays at 10. We ask that you reserve your space, but we'd love to see you even if you don't get a chance to do that. We are thriving and alive and happy and joyful today, and I am so glad you joined us. Thanks, everyone. Bye-bye.